The World Health Organization in South Africa says there have now been more than 5.3 million COVID-19 cases on the African continent and 138,000 lives sadly lost. WHO Regional Director for Africa, Dr. Matshidiso Moeti, said this week that the third wave is picking up speed, spreading faster, hitting harder. She said that the numbers had surged past last year's peak, and at the current pace, continental cases will surpass the second wave's peak in just about 3 weeks. To talk to us more on this, on the vaccine passports and on the resurgence of COVID-19 in African countries, we are joined by WHO's Africa Public Health expert, Dr. Mary Stevens. Dr. Stephen, thank you so very much for joining us here on SABC News. We really do appreciate your time.
Thank you for having me. Good afternoon.
You're most welcome. Before we talk about vaccination passports, I know that was what we were to discuss in the main. I'd like to talk about, of course, the new story that just came in, the breaking news that's just come in about COVID-19 Delta variant that's now dominating infections in South Africa. Can you tell us more about this? I mean, we had been hearing throughout around fears of the Delta variant. In fact, President Joe Biden had encouraged Americans to get vaccinated as the Delta coronavirus variant spreads across the world. What can you tell us about this particular variant, and if we should be more concerned or, around issues around these variants? How should we be feeling about this at this time?
Yes, so as you know, the Delta variant was first discovered in India, and we have seen what it has caused in India. Globally, it has spread so far to over 90 countries. Currently in Africa, it has the Delta variant has been detected in about 14 countries. And if you look at what is happening there, apart from South Africa, it is also dominating in Uganda, in Democratic Republic of Congo, in the new infections. So one of the things that we should be worried about the spread of this Delta variant is because it's highly transmissible. Yeah. This is the virus that has the highest transmissibility so far. Out of all the variants of concern. So you can see what is happening currently in Uganda, for instance, in Democratic Republic of Congo. Hospitals are full, oxygen is not very much available to the population. Cases have surged significantly, including the number of deaths. So as these variants continue to dominate, we will see increase in number of cases, surges in cases because of its increase in transmissibility. If you heard from the UK, about 90% of their new cases was also as a result of this Delta variant. And they continue to report increase in number of cases as well. So we need to make sure that people are observing these preventive measures, wearing your mask, keeping away from others, avoiding unnecessary mass gathering. It will help to reduce the spread of the virus, including, of course, the Delta variant.
I want to continue on that point that you raised, that, it is highly transmissible, the most transmissible more than the rest have been. How much more transmissible can it be? I mean, with all variants, we've been told that these are highly transmissible. How much more can the Delta variant be more transmissible? In what sense? And what more can we then do to prevent this? We're already taking the measures we were told to take all along. So is there anything more that we can do at this point? Because if this is going to be a variant that's a lot more transmissible than the rest, I would imagine that there's more measures that now we must take. I mean, what do we do now?
Okay, yes, transmissibility from some of the information we have is that especially in indoor places, the chances of infection increases by over 60% with this Delta variant. And what we can do, like I said earlier, the virus, including the variants, of course, they move with people. Human beings are the vehicle that the variant is using to transmit. So we have to make sure that preventive measures is being complied with by the general population. Then secondly, as much as we can, if we can quickly expand the vaccination coverage, especially covering those high-risk population, is going to be very, very important.
Yeah, let's go to the topic that we were meant to talk about in the first place, the issue of vaccination passports. Firstly, what exactly is this? Tell us more about vaccination passports, the importance, and how essentially it would work.
Okay, so let me try to simplify it as much as possible.
Sure.
When countries are talking about vaccine passport, it's basically that document that shows the evidence of proof of vaccination against COVID-19. So this could be a digital evidence, or it could be paper-based. For instance, I just recently took my second dose of COVID vaccine here in Congo, Brazzaville, and what we have is paper-based form. In other parts of the world, your record might be electronic. And this is used in the context of international travel. So if you have this document that shows that you have fully been vaccinated against COVID-19, this is the evidence you will use to travel for countries that have put vaccination as a requirement. Then some of the countries, they accept this vaccination status, including testing as well as quarantine, for instance. If you travel across some of European countries, they use that to waive the requirement for testing, to waive the requirement for quarantine. In Africa, we still do not use vaccine passport as evidence for international travel, and WHO globally does not recommend the use of vaccine passport for international travel because of the inequity in the distribution of vaccines.
Yes, and actually on that point, what I wanted to say was, it does seem, of course, that the EU is supporting this COVID-19 vaccination passport. And, my biggest concern as you were speaking was, whether or not this has the potential risk, of sounding like something that could be a restriction of movement, essentially. If we're going to have a sort of passport that, proves that you've been vaccinated, and if you don't have it, you can't move around, that would essentially be a restriction of my movement, would it not be? It is risky, isn't it?
Yes, this will definitely put restriction, especially on Africans. If you look at our statistics, out of the almost 2.7 billion doses of vaccine that have been administered, it's just like 1% of these doses have been received in Africa. So we have about over 1 billion population on the continent. Just imagine 1% of that population able to travel globally. It's definitely going to put some restrictions on travelers, especially from Africa. And just to add that, countries need to hold on to and respect their obligation under the international health regulation, which says that we will limit the international travel, we will limit the international spread of diseases, but we should avoid unnecessary interference with international travel. And this requirement for a vaccine passport is one of those things that could limit international travel.
Yeah, and of course, with the third wave about to probably soon hitting across the continent, while you and I discussed the issue of travel, shouldn't cross-border travel really actually be restricted to keep COVID-19 from spreading throughout the continent? I was listening to our health minister here in South Africa, our acting health minister rather, Matshidiso Moeti, who was saying that, look, we won't shut down the country completely. We won't shut down travel, and I wonder if that's a good move. I mean, what is your reaction to that?
Okay, so let's contextualize it a little bit.
Yeah.
If you remember from the beginning of the outbreak, countries, especially in Africa, they use these travel restrictions to limit the spread of this virus. But over time, we have seen that it's not sustainable because it has greater impact on the economy. There is an estimation of over 378 billion losses in terms of economic losses globally. It's a lot, and we have seen the impact in Africa. So now countries have to balance the economy as well as, of course, the COVID prevention and control. And as a result, they are using what we call the risk-based approach.
Yeah.
So there is no one blanket suggestion. For instance, you look at the risks, look at the transmission, and then in the context of this new variant, assess the risks properly, and then before you can come up. So as much as possible to encourage safe travel, for instance, rather than completely closing the borders, that would be helpful. So as people are traveling, doing their testing, and in some countries where quarantine is required, they try to observe some of those measures to facilitate travel. We are traveling, the economy is still moving.
All right. Dr. Stevens, a great pleasure speaking to you. Thank you so much for giving us your much needed input. Thank you.
Thank you.